Oh, good morning, everybody. It's Dr. Galvin with a post-night shift COVID update. For those of you just joining us, my name is Jeffrey Galvin. I'm a board-certified emergency medicine physician. I also run a functional medicine clinic outside of Charlotte, North Carolina, but I still work shifts in the emergency department, and I've been doing some updates about the virus ever since it started back in March or so. I haven't done one of these post ER ones in a little while, so I figured it was time to do one. Busy in the hospital, long night, and talking to my partners. The hospital's full. A lot of COVID patients. Our ICUs that is dedicated to COVID is pretty much full. We're seeing patients that we're admitting for COVID every day, and we're also seeing a lot of patients that don't need admission, that are not really that sick, or we have low suspicion they're going to get worse. Some of those people subsequently get worse and do come back, but we are admitting people that kind of come in with the classic sort of hypoxia, low oxygen levels, fevers, cough that is sort of classic COVID. We know that there's a wide range of symptoms, but generally, if you're going to get admitted, you're going to be hypoxic and short of breath. That's probably one of the main things that's going to get you admitted with COVID. 14.7 million cases worldwide, 610,000 deaths here in the U.S. 3.9 million cases. We had an increase of 62,000 cases just yesterday, 143,000 deaths. Hospitalizations in North Carolina, which we've been talking about, have actually dropped a little bit. I think it peaked out around 1,200, and I think yesterday was 1,080, so that's good news that maybe we're starting to see some improvements there. We're also been watching case positivity rates, and that's like the number of tests, of the number of tests we're doing, which we're doing a lot of, how many of those people are positive for the virus. And ideally, we think that the virus is under control if that number falls between 3 and 5%. Some places like Arizona and Florida have been in the mid-teens in terms of their case positivity rate. North Carolina for the last few weeks has bumped between 9 and 10%, but I have noticed in the last few days we're down to 7%. So I don't know if that's a trend. I don't know if there's enough data there, enough time to really look at it to really determine that, but it does look like things may be getting better. And if you remember, a couple weeks ago when North Carolina came out with a mask mandate, I said that we would see the results of this in 2 to 3 weeks. And now that time has passed and we're starting to see some drops in cases. So I'm hopeful that the social distancing and masking that we're doing is going to have that positive effect and start lowering numbers. I want to talk a little bit about a study that came out of South Korea looking at virus transmission. And we've talked about reopening schools, and we've talked about how kids are at lower risk. Well, this was an interesting study because what they found was the younger the child, the less risk of them passing the virus to other people, but the older the child, the more risk. And so what they found was that when they identified an index case, meaning what they thought was the source of the infection, that was a child in a household, if that child was less than 10 years old, other people in the house developed COVID about 11.8% of the time. If that child was between 10 and 19, other people in the household developed COVID about 19% of the time. So almost twice as many people were getting sick if they got exposed to an older child. And we talked a little bit about this at one point, that maybe the amount of viral load in a child is probably fairly low, and the amount of air exchange they can have from coughing or breathing is low. And remember, the amount of virus we get exposed to really does have an effect on how badly you get sick or how quickly you get sick. And so if we can limit the exposure, so if you're going to get COVID, you really want to get infected by a small inoculum of virus as opposed to a great big one. And that's another way that social distancing and masks may help, by lowering the amount of virus you get exposed to. But that's interesting, and it may be inform our school decisions, because we know that those kids who are fourth grade and less are going to struggle with being at home learning online because those, they just don't have the attention span and everything else. And if it indeed shows that they're at lower risk, maybe there's a role for getting younger kids back to school a little bit earlier and maybe keep the older kids isolated. We're going to probably talk about this quite a bit this week. Remember, we're going to do a physician Q&A. Dr. Bream, Dr. Hogenkamp, myself, and we may have one other physician join us. And we're going to be answering your questions. So if you have questions that you want answered, please put them below or put them on the video I did yesterday, which was about running down all the current treatments that are available for COVID. So if you put questions in any of those spots, I'm going to pass those out to the docs, and we're going to try to answer just as many of them as we can. I think I'm going to post that video on Friday, although it sounds like we're going to probably film it on Thursday evening based on all the docs' schedules. And so we're still working on that one. I think that one of the interesting things we talked last week, I talked about all the different vaccines and what's going on with vaccines. And now that we're going into phase 3 trials with 4 vaccines, phase 3 requires 30,000 people to get the vaccine in order to have enough power to determine whether the vaccine is effective and whether it's safe. And so we need, about 120,000 volunteers to have this vaccine tested on them. And so far we've had 107,000 already. So it looks like we're well on our way to having enough numbers to adequately test the 4 current vaccines that are ready to move to phase 3 trials. And so that's good. And there's 107,000 people that are looking out for their fellow man, and that's a great thing. One of the questions I've gotten quite a bit of is these delays in testing. So, early on, I think I mentioned very early when we first started, talking about COVID, when we were taking a week to get tests back, and then they came back with rapid testing, and those turnaround times have helped come down quite a bit. Now, in the hospital, we have to make a decision. If you're going to be admitted, we need to know whether you're going to go to a COVID floor or a non-COVID floor. So everybody needs to get tested in the hospital. So if you're being admitted, we actually have a rapid test that we use, and we get the results in an hour and a half or so. However, those tests are in short supply, so I think we only get 100 a day at our hospital. So we've got to be careful about how we use them. All the other ones get done in our system. They go done and they go to LabCorp. I talked to our LabCorp rep last week, and LabCorp North Carolina has the ability to do 35,000 COVID tests every day, and they're working to expand that capacity as we speak. However, they're getting 50,000 a day. So I was told that our results that we were told to originally expect in 3 days now may be 5 to 10 days to get those results. We're still able to do the rapid testing in the hospital for those particular patients that need to come in, but everybody else is getting sent out. And again, it may take 10 days for those results to come back, which is obviously not what you want to hear, especially if you think you may have the virus. But also, for many people, they've got to quarantine or change their schedules based on that testing. And I can tell you, we had somebody in our office that was sick over the weekend and had a fever, and I said, you can't come in. We've got to protect our patients until we know. And so I sent her to get tested on Saturday, and surprisingly for her results came back yesterday, and they were negative, and that's great news. But I don't know. I haven't seen her because she's been sick, but to kind of find out where exactly she went and where they're using. Who they're using for their testing. The fact of the matter is that the demand for testing is essentially infinite at this point. All the big players are trying very desperately to add capacity, and that will improve as time goes on. But right now, there's such an explosion of cases, which then means an explosion of people needing to get tested, and that is why it's difficult to get tested now. And some people are traveling and require a test for going back to school, things like that. So if you think you're going to have something like that where you need a test, make sure you get it done early, because it may take a week or more to get the results. Or if you're lucky, like our employee, maybe you'll get it in 2 days. I'm going to end it there. I am tired and it's been a long night. We are going to do Wellness Wednesday this week. I'm going to talk about osteoporosis, and so we'll film that video probably either tonight or tomorrow. And then we'll do the physician Q&A, which will be posted on Friday evening. Again, please write your questions below here, either on YouTube in the comments or on Facebook in the comments. If you find this helpful, please subscribe to my YouTube channel, Vitality Medical Wellness Institute, or follow me on Facebook, Vitality Medical Wellness Institute. There's lots of information there we've been posting since the very beginning of this crisis, and hopefully it's valuable information for folks. As usual, wash your hands, wear your mask, take care of yourselves, take care of your families, and look out for those around us. You know, we're all in this together, and we're going to get out of this together if we keep understanding that, okay? Good night, everybody. I will talk to you on Wednesday. Have a great day.